Welcome to The Pulse, the official podcast of the Georgia State Medical Association.
Hello. Welcome back to The Pulse. My name is Julianne Adams-Burt, otherwise known as Dr. Ju, and I am very excited to be here with you. And let me tell you why, because not only is March Kidney Month, right? National Kidney Month, but I have the most phenomenal physician, author, speaker, podcaster, all the things with me tonight. She is a nephrologist, and I am so excited that she agreed to join me. So please welcome to the stage. I'm going to give a little more of your bio, trust and believe, but I want you to see who I am speaking of because she is one of ours. This is none other than Dr. Frita. So Dr. Frita, welcome to
Thank you,
The
Dr.
Pulse.
Ju.
All right, so let me tell you, Dr. Frita, or Frita McRae Fisher, we know her as Dr. Frita, is a triple board certified medical doctor. She has certification in nephrology, hypertension, and diabetes. She is widely regarded as one of the premier specialists in her field. I do believe you have also been certified in obesity medicine.
I have. I'm board certified in obesity medicine as well.
So she's quadruple expert here. So extending her influence beyond the confines of just practicing medicine, Dr. Frita has emerged as a prominent medical expert commentator. She makes appearances, y'all write all this down. She makes appearances on various national and local television networks, including HLN, Fox News, NBC, CBS, BNC News, the Emmy Award-winning Paternity Court, Personal Injury Court, Good Day Atlanta, and I am so excited when I just so happen to see her next to the one and only Don Lemon. We ain't talking about this one time. She ain't one and done, y'all. Don be calling her, like, let's discuss. We need you to discuss. So she is an active National Kidney Foundation board member since 2014, and she is committed to health, education, and advocacy. She was honored in 2022 by the 100 Black Men of Atlanta with a Youth Health Award, and we are honored tonight because not only all the things that I've already shared, but this phenomenal woman has nearly 1 million YouTube subscribers. So when I thought, and I'm a past educator, right? I taught in the Atlanta public schools for 1.5 years before I got into medical school. And I love when someone can utilize their abilities in all aspects. Every doctor doesn't do that, y'all, but she does just that. And so she was the perfect person during March's National Kidney Month to bring on. So welcome, Dr. Frita.
Thank you.
Yeah. All right. So we are just going to have a conversation. You know how we do. This is, I tell my physician colleagues, this is not for CME. This is not for continuing medical education. We are not, going to take a test at the end of this, but we want to enlighten our viewers, our audience members. One of the things that during my tenure as president of the Georgia State Medical Association, I want to make more of an impact. And so simply coming to where people are, and of course before, but definitely since COVID, people are online learning all things. So we want to get to it and talk about kidney health. So could you please, Dr. Frita, explain to the peoples, and even me as a gynecologist, explain to us what is kidney health? What is the importance of kidneys in the body? and overall, what is its role in overall wellness?
Yes. Well, Dr. Ju, thank you for the introduction, first of all. But I am excited to be here, and I'm super excited for March being Kidney Disease Awareness Month, because we all hear about Heart Month, we hear about Breast Cancer Awareness Month, all very, very important illnesses, diseases for which we should be aware. But when it comes to kidney disease, people are just like, huh? Kidneys? When's Kidney Disease Awareness Month? What are the kidneys? So a lot of people really don't know. But the truth of the matter is that over 37 million Americans have kidney disease, and most don't even know it. Most don't even know it. And when your viewers listen, and when I really explain what kidney disease is and how to know if you have it, we're going to have some folks shocked to find that they are at risk for having kidney disease, or that they actually have it. So I want everyone to really just listen. So as far as your kidneys, so most of us are born with 2 kidneys in our lower backs and our flanks, where the love handles are. And each kidney is about 9 to 11 centimeters long. And your kidneys are responsible for filtering out your blood. They filter out your blood. They get rid of excess water in the form of urine. They get rid of excess toxins. Certainly, they help to balance your electrolytes, like your salts, your potassium, things of that nature. So they're very important in that aspect. But kidneys do so much more. They help to make sure that you're not anemic. They actually help to make sure that you have active vitamin D, so that you have strong bones and a good immune system. The kidneys help with your acid-base balance. It's just really amazing all the things that the kidneys do. And they even help to regulate your blood pressure. But here's the thing. It's quite easy for your kidneys to stop functioning well without you even knowing it. Okay. They can be like a silent killer, in fact. And so, Dr. Ju, I just want you to tell me if you still hear me here.
I'm with you.
There you go.
I am with you. Yes.
Good. So the way that we measure kidney function, the way that you can know right now, is to take a look at your labs. Go to my chart. Anyone listening can look at their labs, and there are certain kidney labs. There's a BUN, creatinine, and then there's the EGFR. And knowing your EGFR is how you can know if you have kidney disease. We call it CKD, or chronic kidney disease, when the kidneys are not functioning as well as they should for 3 months or more. That's called CKD. And you know if you have CKD based on that EGFR. If your EGFR on your my chart, on your labs, is 90 or greater, then you're good. Your kidneys are functioning properly. If your EGFR is between 60 and 89, and if it's been that for 3 months at least, guess what? You have CKD, you have chronic kidney disease, CKD stage 2.
What?
So
Wait a minute.
Yeah.
Okay. Now I'm trying to digest this. So over 90 is the goal.
That's normal. Mm-hmm.
That's normal. And it doesn't matter if you're black or white, right?
It doesn't matter if you're black or white, which is interesting. They used to make a discrepancy between black and white, but we've gotten that changed largely because what would happen would be a black person and a white person with the same exact creatinine, the same exact kidney lab in that case, would be calculated to have different EGFRs. A black person would have a better kidney function based on the EGFR than the white person, which sounds like, yay, if you're black, okay, you get one up, great. But here's the problem. When it was time to get kidney transplants, that would mean that black person who had the same creatinine, that same kidney lab as the white person, the black person's kidney function would be considered too good to get the transplant. And so black people were being on the list longer than non-black people. And that's why a lot of us, like with the National Kidney Foundation, American Society of Nephrology, we lobbied to get that changed. And so the transplant units in the United States have now changed that discrepancy between black and white. So yes, hello, Michael Jackson. It doesn't matter if you're black or white.
So I'm sorry, I stopped you, but I definitely wanted to hear those numbers, because I think you know how it is when you do patients' labs and they get, it may be on their my chart, or they get a portal message and says, oh, your numbers are, your labs are bad. They don't know how to read them. So I want people to go away with understanding. You're looking for 90. I think we can understand it. That's an A, right? A 90.
Yes, a 90 or greater. That's an A.
That's an A.
That's a good one. Yeah.
You
See,
want,
I can tell you're an educator because you broke it down.
yeah, you want people to remember some things. And
Mhm.
so when you look at your GFR, um, look for 90 or greater. And 60, I heard you say 60 to 89
Mhm.
is where I mean, 89, like just even at 89, you're considered,
It's
oh, you said as
technically,
long as it has to be 3 months apart, right?
yeah, well just it has to have been going on for at least 3 months.
At
So yeah, so to
least.
get one, your doctor has you come back in 3 months and you're still between 60 and 89. It's considered to be CKD stage 2. The good thing is that's a very early stage, and so that's not time to freak out or anything. You can live
Okay.
a full, wonderful, great life, but it's just important to know that you're already on the radar between 60 and 89. And Dr. Ju is not going to light up as abnormal on your labs. It's going to light up as being normal. And so it's important that you know that information.
Okay. I'm so glad you said that because there's so many lab values that we say the same thing in women's health, like, well, the range looks normal, but it's not. So thank you for saying that.
Mhm.
So we want to be an A, we want to be 90, but well, is 60 considered an F? Okay, so F, is that a D or an F? I don't know. I don't know. My kids
Yeah,
are.
but this is different because we're going to take it all the way down to less than 15%. So we got to get off of
So we're just one stage down.
right,
Okay.
right.
So
Because the way we stage
60,
it, there are 5 stages.
five,
One is
oh,
the
we
best.
only in, okay.
Yeah,
Whew.
5 is the
Okay.
best.
So 60 to 89, but you can bounce back.
You can bounce back, or you can even, quite honestly, stay in stage 2, and you would never need dialysis, never need a transplant. But you do need to be aware of doing that. You need to start doing things, lifestyle management, to make sure you maintain that kidney health. So you can stay in stage 2, have normal electrolytes, do really, really well. It's kind of like a warning. I guess you could equate it somewhat to pre-diabetes. If someone has pre-diabetes, they can stay there for the rest of their lives as long as they're very, very careful not to let it go to the
Gotcha.
next stage.
Gotcha.
Almost, yeah, like a warning when you're in
Correct.
stage 2.
Okay. All right. And
Yep.
so 59, where are we going with this?
So yeah, when you're down less than 60, then this is very important. It's important for providers to know this too. If that EGFR is less than 60, then that's the time that it's standard of care to refer your patient to a kidney doctor. And so for anyone who's listening, if you look and you see, my EGFR is 59, is 43, is 57, please call your doctor, your primary care doctor, and say, please refer me to a nephrologist, a kidney doctor, because this is CKD3. If it's between 30 and 59, if that EGFR, estimated glomerular filtration rate, is between 30 and 59, you're in CKD stage 3. And that's the middle of the road, because remember, there's 5 stages. And that's when you actually can start seeing some changes. The blood pressure might go up. You might start holding on to salt and getting swelling of your feet and your ankles. You might even notice that you start to become anemic because your kidneys actually make a substance called erythropoietin, or EPO, we call it. And that stimulates your bone marrow to make red blood cells. And so there's a direct link between kidney disease and anemia, and you might start to become anemic at stage 3. So that's where you can start to have some signs and symptoms. And so it's very important for providers to know if you see that your patient has an EGFR of less than 60, and for patients to know, go to your MyChart, be your own advocate. If that EGFR is less than 60 and you're not seeing a kidney doctor like me, ask to see a kidney doctor. Because here's the thing, Dr. Ju, a lot of times I'll see patients at stage 3 and I'll be able to go in, I do my history, my physical, all of my evaluations, and I might find a medication that has the kidneys not functioning well, or I might find that my patient's not drinking enough water. And then the top 2 causes of kidney disease are, number 1, diabetes, number 2, high blood pressure.
Yeah.
We might be able to get the diabetes under better control, the blood pressure under better control, and they can improve from that stage 3 and literally pop back up to the next stage. And so in seeing a kidney doctor early on, oftentimes the kidney function really can be reversible.
Okay.
Yeah.
Well, that's good to know. That is good to know. Okay. All right. Now we're going to 4.
Yeah, we don't want to go to 4, Dr. Ju.
No.
Yeah, but if that EGFR is less than 30, if it's between 15 and 29, that's stage 4. And so that's next to the final stage. And so that's when you really can start having problems. Like you can have potassium that is too high. And that's important. A lot of patients don't realize that, when your potassium is too high or you have hyperkalemia, that's because your kidneys are responsible for filtering out your potassium. Well, if they're not working well and that EGFR is less than 30, okay, like less than 30%, then you get a buildup of potassium. And this is an issue because it can cause heart problems, heart arrhythmias, so abnormal rhythms. Right. It can even cause the heart to stop. And a lot of times, so at stage 4, I'll tell my patients, okay, I need you to really cut back on foods that are high in potassium. And they're like, okay, no problem. What foods are high in potassium? And then I start listing all these really healthy foods like bananas, tomatoes, oranges, even spinach or nectarines. And they're like, what? And so it's really hard to be compliant, to really agree to that diet. But I have to break it down and say, potassium that's too high is dangerous, because if you think about people who are, in prison and they are on, a life sentence and they're going to go into the row where their life gets taken, they're on death row. If they get a lethal injection, to be blunt, that injection is of potassium. And so imagine if you're in stage 4 and you have high potassium, you literally have that same substance that's too high potassium and your heart can stop. And of course, I've seen patients sadly pass away because of high potassium. Yeah. And so when doctors tell you something, even if they don't stress it, just remember these words. If they tell you your potassium is too high, you need to cut back on high potassium foods because you're in stage 4 kidney disease. It really is life or death.
Yeah, absolutely. And so I'm seeing even more now the importance of having that nephrologist as part of the whole team, as part of the team, right? Because as a different specialist, I now need to think about medications that I may be prescribing, right? So any doctor prescribing a medication, or if you go to the emergency room and get something, I don't know, heck, you could go to your dentist and need something. I don't know. You have to be very careful, be very mindful of what you are taking in that could impact those kidneys.
Absolutely.
Or the medications, right? Oh my gosh, it's scary stuff. But
right.
I didn't hear you use the word dialysis yet. So I'm like, so that's not stage 4?
That's not stage 4, but it's stage 5.
Could it be used?
The only time it will really happen in stage 4 is if you had someone who had a really high potassium at that stage and that we couldn't get it under control. Even though now, in recent years, we have certain medications, not just the one Kayexalate, which used to be really widely used, where you would drink it and it'll make you use the restroom and get rid of potassium, but it could cause other issues. Now I'm able to give patients medicines, little powders that they can mix with fluid, take every day or take every other day. And even in stage 4, if their potassium is high, we're able to keep them off of dialysis because we can control the potassium. But yes, if you were in stage 4 and we could not control your potassium, or if for some reason, even though you're in stage 4, maybe in addition to kidney disease, you have really bad heart failure and you have a lot of fluid that's building up in your lungs, then in some cases you might need to have dialysis. Not very often. Typically, it's not until you progress to stage 5 and that EGFR is less than 15. That's the final stage. At stage 5, that's when you're eligible for dialysis or for a kidney transplant, some type of a kidney replacement therapy. But here's the really important thing. Just because you progress to stage 5 and that number is less than 15, all of a sudden, all of the lights don't start spinning and all of the ghosts come around. You don't automatically have to be on dialysis just because your EGFR is 15. And that's really important because I'll have patients come to me and they want a second opinion, and my EGFR is 14 and the doctor's trying to put me on dialysis, but I'm making urine, I feel good, my numbers are good. Doc, do I have to go? And I tell them, well, you're definitely at high risk, okay? So at very least, and even starting in stage 4, that's the time where it's important that patients have education on the different types of dialysis. It's important that they have education on transplant and be referred to have a kidney transplant, if that's their desire. But even when patients have EGFRs, the estimated glomerular filtration rate of less than 15, I tell them I'm treating you and not the number. And so if your number is low, but you still have your good mind, you don't have confusion, you don't have easy bruising, you don't have high potassium, if you are still making good urine and so you can breathe well, you can move well then, hey, It's the standard of care, by KDIGO, ASN, NK, all of our organizations as nephrologists. It's a standard of care that you wait and you don't put a person on dialysis until it is time, until their body actually tells you, not just the number, but the numbers give us guidance.
Got you. So tell us this. If someone is at that point where you, as their nephrologist, is considering, putting them on a transplant list, how do you, what are just some, you're not going to make it on the list. Potassium, we can't keep that under control. Or smokers, is there a BMI? Is there, what other things would just automatically keep somebody off of a transplant list?
Okay. So for the transplants, we take that very seriously. And in fact, the nephrologists who are over transplant actually do an additional fellowship in addition to the general kidney fellowship that all kidney doctors do. There's a transplant specialty. And because the gift of life is so important, whether it's a deceased donor, like a cadaver donor, or a living donor, we take it very seriously. And we will not even permit a person to receive a kidney unless we know that they are optimally healthy enough to receive the kidney and that they're in the proper state of mind. And so we put you through a rigorous evaluation. Okay. So first things first, we make sure that you are a compliant person. And I get calls from the transplant, my transplant colleagues. Okay, hey, Dr. Frita, we see this patient of yours. Is this someone you think would be a good candidate? And I tell patients when they start, skipping treatments or not taking medications, I say when the transplant office calls, I'm going to be honest. So if you're a person who's not considered to be compliant, like you don't listen to your doctors, you take your medicines when you feel like it, you go to dialysis when you feel like going, you don't show up to appointments. If you're not compliant, then automatically you will not get that transplant, because the thought is, in order to maintain a transplant and keep your body from rejecting a transplant, you have to take anti-rejection medicines every single day. That requires discipline. It requires compliance. And so if already before getting evaluated, you've shown that you're not compliant, you're not going to get it, because there's no buddy system, sister girl, this or that. We take the gift of life very seriously. And I would never, I love my patients to love them to life, as some folks say. But I'm not going to allow their cousin to donate a kidney to my patient if I know good and well that you're not doing what you're supposed to do. Do what you're supposed to do, and then we'll change the conversation. So that's one thing. The other thing, we have to make sure that you're healthy, that your heart is healthy enough to have the transplant. So we put you through a cardiology evaluation, stress tests, things of the like, making sure that you don't have clogged arteries, making sure that your lungs are good enough. You have, healthy lungs. We also take you through cancer screening, like age-appropriate cancer screening, making sure that there's not a colon cancer that pops up, a cervical cancer, a breast cancer. Because if that's the case, we need to pause, treat the cancer, and then come back and evaluate you at another date. And here's something that a lot of people don't know, Dr. Ju.
What's that?
We have a mental health evaluation.
I did not know that.
Yes. Are you going to be mentally well enough? Do you have a severe depression that you're dealing with to the point where you're not sure if you even want to be here? If so, time out. Let's get you taken care of there. Do you have a severe anxiety disorder to the point that you panic and that keeps you from taking medicines well? No. Do you have you gone, through the radar where you have, schizophrenia that perhaps might have you where you're disconnected from reality? So then you have bouts where you're not really in touch. That's not going to disqualify you, but we need to make sure that everything mentally is at an optimal situation. So we do all of those things. And Dr. Ju, we don't only do it for the person who wants to receive a transplant. We do these things for a person who's giving a kidney or who wants to donate, because guess what? It's very important that we protect our donors. And here's something that's happened. It's happened more than once, but there's a very specific case I think about where I had a young man, successful. He was a husband, he was a father, and just a really kind person altogether, a young Black man in his
Mhm.
40s, and had kidney disease, a genetic reason, not even any particular thing that he had done. He didn't have diabetes, he didn't have, doing drugs or this, that, and the other. And that's another point. A lot of times people look at people with kidney disease and they're like, oh, what did you do? You weren't living right. No,
Yeah.
the cards you're dealt, right?
Right.
Yeah, you might have lupus, you might have diabetes, even if you're exercising, 5 days a week, and you might just be genetically predisposed. This is just kind of one of those guys. And his sister, young, healthy, beautiful young lady, went through her evaluation, all of those things. Now, here's something. When my patients go through evaluations, the transplant team might call me to make sure they're compliant, but that's about the only conversation we have. They purposely keep the primary kidney doctor, like me, out of the loop because they don't want us to reveal certain things to the kidney patient that we don't need to reveal.
Okay.
In going through the evaluation, if you're someone who wants to donate a kidney, again, we protect you. If you're not healthy enough, don't worry. We're not going to take your kidney from you. So you don't have to worry about that. But here's the other thing. Even if you are super healthy and a perfect match, if you get to that psychological evaluation and you realize, I'm scared, or I just feel kind of pressured because I don't want to be looked at as a bad sister if I donate the kidney, the psychologist will say, you can't give the kidney.
Wow.
And then when the information gets back to my patient or me, it doesn't come back as, ooh, she's a match, but she don't want to give you a kidney. It only comes back as not a match.
Not a match. Yeah.
Yes. So we protect donors.
Right.
Donors. Because guess what? If you're a kidney patient, you don't want a kidney from someone who doesn't fully want to give and who's not fully mentally ready to give. Okay. For anyone who's considering being a donor, don't worry, you'll be protected. And look, and you might find out about some health issues you didn't know about. So it's kind of like a freebie chance to get screening. So yeah. And another thing about donors, because it's not really common knowledge, for us being in the medical field, certain things start to seem like common sense after years and years and years. But I've learned that a lot of people say, Doc, if I give up my kidney, I'm going to be stuck with half of my kidney function, 50%.
Right.
Nope. All you need is one kidney to live and to live well. And if you donate your kidney, the other kidney bulks up and does the work of two.
Does the work for you.
Yes.
Okay, Dr. Frita, I'm sorry. Because we're talking about donors, I have got to tell you this funny.
Uh-oh.
I've got to tell you this funny. So, again, I am an OBGYN by training, certified, but I don't deliver babies anymore. But back when I was still delivering babies in my own practice, one day, I just crack up when I think about this. I'm in the midst of a woman delivering, and I'm just going to be honest. I was like, we were all trying to encourage her. You got to push. You can't be wimpy. You got to push. And I remember getting in this poor woman's face, and I said, you are about to be somebody's mother. You have got to learn how to sacrifice. I know it hurts, but you've got to push, and push and forget the pain. You got to get this baby out. Because if you don't, we may end up with a C-section. Like, I am all in her face. So healthy baby comes out. And let me just preface it by saying she was not my patient. I had just come on. Someone signed out her care to me. And when I went back to the chart, this woman had donated her kidney to her mama. Who else doesn't know about sacrifice? I was like, that was so not a good thing to say. I'm talking to this woman about sacrificing, and she already did have a kidney. I was like, did y'all tell me that and sign out?
Okay. She's like, I'm blessed in life, and I've given the gift of life to my mama.
The gift of life.
Oh,
I will never forget that. I was mortified. But she had a healthy baby, and we had donated a kidney to her
which is
mom.
really just a testament, because that's the other thing. You can donate a kidney and definitely still have great fertility, do all of the things that you would have done before. Yeah.
All right. Dr. Frita, could you please, for someone who knows that there is maybe some, I don't know, genetic predisposition or just something in the family, if I'm 21 years old, and I'm, of course, no longer with the pediatrician, what kind of screening, how often, when should I start? What if I don't have kidney disease known in my family? What are the current recommendations just for the regular average person, and then someone who has known kidney disease in their family for screening?
Wonderful. So at 21, the recommendation is to be seen by a primary care physician, a PCP. So internal medicine doctor, family doctor. That doctor, when you go and you see your just a regular doctor, they're automatically doing a kidney screening, whether you know it or not. They're doing the BMP, Basic Metabolic Panel, which has the EGFR number in it.
Mm-hmm.
The other thing that will be recommended, that in the history and the physical, your doctor is going to see if you have diabetes or if you're at risk for diabetes. So for at least the initial visit, I recommend a hemoglobin A1C, which lets us know if you have diabetes, if you have pre-diabetes, because again, diabetes is another one of these silent illnesses. And if your hemoglobin A1C is normal, if it is less than 5.7, then you don't have pre-diabetes and you're probably in a safe range until your next visit, or even the visit after that, depending on your risk and your family history. If that hemoglobin A1C is between 5.7 and 6.4, well, then you have pre-diabetes, and now it'll be time to screen more frequently. But for that initial one, if you don't have pre-diabetes, great. The other thing at age 21 is to make sure you don't have high blood pressure. And so we know that that definition of high blood pressure has changed somewhat recently. Well, I guess it's not recent anymore, like 2017. But if that top number is 130 or higher, or if the bottom number, the diastolic, is 80 or higher, and that is your consistent blood pressure, you have high blood pressure. And I'm sure people listening, Dr. Ju, will be like, oh, no, that's normal for me. My blood pressure runs 130s overnight. It runs higher in my family. If your blood pressure is 130 systolic or diastolic 80, if it's higher than that, you have high blood pressure. So even if you're a 21-year-old, automatically now you're at risk for kidney disease. And then the other thing, and this is really important, and I know that gynecologists, OBGYNs are very good at this, checking for protein in the urine. And so, yes, there's that urinalysis, or that dipstick, to see if you have 1+2+ urine protein in the urine, but also a more specific test, urine albumin to creatinine ratio. Okay. Yes, for anyone who's 21, and certainly for everyone who's growner than 21, just go ahead and write those things down to make sure that when you go to your regular doctor, you know that you've been screened properly. Say, hey, doc, did you do a BMP? Will you do a hemoglobin A1C? Will you check my urine albumin to creatinine ratio? What is my blood pressure? And that will be your initial screen. And if any of those things are positive, then it's time to talk about the next steps in being screened. But initially, just your yearly visit, your annual visit, or however frequently your doctor has you go. Yeah.
So what about the average risk person who doesn't have a family history? Would you do the, National Kidney Foundation and whomever recommend annual BMPs? Or is it every 2 years, every 5 years?
Yes, it's going to vary, but at least I would have a BMP every year.
Okay.
Every year, yeah. And a lot of this is, some doctors will say every couple of years for patients who are in their 20s if they're really, really at low risk. But here's the truth of the matter. Depending on the population you're serving, you might automatically have a population at high risk. For example, if you're serving the Black community, automatically we have a higher risk for diabetes. We have a higher risk for high blood pressure, and we are among the highest at risk for kidney failure and dialysis. Okay. We are way more likely to be on dialysis, way more likely to have CKD than non-Black patients. And so automatically, especially for Black people at high risk, also Latinos, also Pacific Islanders, I say at least every year a BMP. Okay. And evaluating the urine and then going from there.
Good. I feel justified with that there, because I do. I offer it. My patients don't have a primary care physician or a provider. Yeah. I do all those labs. Now, when they're abnormal, I'm going to ship you out, but I do all the labs as a gynecologist, and I offer them annually. So
And that's brilliant, Dr. Ju. So you understand. So there's no secret to you that a lot of women, and I remember even being someone, a med school doctor, when you're transitioning from a pediatrician to being an adult, then a lot of times, especially for women, you're right, the OBGYN is your only primary care. My OBGYN had to pretty much push me out of the door and say, you need to go get a primary care. And I'm like,
Yeah.
but you have a good rapport with me.
You know about me. You know
Yeah.
me. You
Yeah.
take care of me. Right. I say the same thing. But I'm going to remind our listeners, COVID should have been a huge wake-up call, because I remember all the news stations, right? What was the message that we would hear at the end of the broadcast, or at the end of that horrible story when it was showing all the footage from New York and hospitals? They would say, if you have these symptoms, call your primary care physician.
Mhm.
And ever since I was in med school, we've always said that for women, at least 50% of women only see an OBGYN. And so when they said, call your primary care physician,
they're calling you.
I'm like, yeah, but I don't know, I wasn't the one that you should be relying on. So it is very important for you to establish care, and also for many of our folks in our communities who use the emergency room as their point of care, or the urgent care these days. That is not your primary. The word is primary care physician or your provider. So it's very important to establish that. Also, I am not ashamed to tell patients, I graduated, literally this year is my 25th year since I have graduated medical school. I do not do internal medicine. I am not a family physician. And what if, now I know that the rules have changed, the criteria has changed for blood pressure, but what if I didn't know? And I'm allowing you to keep walking around with your 135 over 89 because you aren't 140 over 90, which is, what we tended to say in the past. We know more. So please, I hope you are taking some notes, or at least you'll come back to the replay and listen to all the good information that Dr. Frita is sharing. Yeah. What are just some basic practical tips? If someone says, oh, this is scaring me, how do they protect their kidneys? What are some practical day-to-day life lessons that we need to walk away with and start making some changes tomorrow morning?
Water. That's the first thing that comes to mind. Would you believe that being dehydrated is a big cause of kidney failure? You already know. And it's funny because by the time we feel the sensation of thirst, we're already behind. Our kidneys are already dehydrated. I've literally had to put patients on dialysis because of severe dehydration. We have nursing home patients who come in who are not, especially if they have a little dementia, some memory loss, and they're not able to express when they're thirsty, and they don't have a family member sitting there advocating for them. I've had patients who've been so severely dehydrated, they've gone into kidney failure and needed dialysis because of dehydration. And so imagine the rest of us running around, working a 9 to 5, not having time to go use the restroom, going on road trips, you have to drink water.
Wow.
Yeah, it's going to vary from person to person.
But you just said something I have never in 25 years heard. By the time you are experiencing what you consider thirst, your kidneys have been calling your name. Help, help. They've already been calling. So when people say, I don't like water, I don't like the taste of water. Is it okay? Because people ask me this question. Well, is it okay if I just use one of the little packets and sprinkle it in and still get my 8, what did I say? 8 ounce
glasses?
Yeah. But is it okay when they pour in the little packets? It doesn't matter which type of packets. They say it's electrolytes, or a lot of them are just lemon flavor or tea flavor or whatnot. Is it giving them the same benefit?
I say yes, and this is why. So, of course, if you can tolerate just, plain water, distilled water, spring water, filtered water, great. That's going to be the best thing.
Mhm.
But if the choice is between not drinking water because you really don't like how it tastes versus using a flavor packet, I tell my patients, yes, flavor packet every time. Usually something like a Crystal Light and something that's sugar-free like a Crystal Light. I don't recommend the electrolytes unless you know your electrolytes, okay? Because if you're, for example, someone who's already at risk for kidney disease and you have high potassium, I don't want you adding potassium in
Right.
an electrolyte packet. But for typical water flavors, especially if they're sugar-free, and if patients actually take the time, and because this is what I actually like to do, get one of these big old jugs. You can cut you up some lemon, some mint, or some strawberries, and just different fruits, blueberries, and just let those things soak overnight in the refrigerator. And that gives you a really delicious infused water with natural fruits with antioxidants. That's even better. But yes, if the choice is between a Crystal Light or a flavoring versus not drinking water, yes, flavor the water and get it down, because it varies from person to person. But for most patients, most adult patients, as long as they're not on a fluid restriction, like from heart disease, congestive heart failure, or from chronic lung disease, anywhere from 2 to 3 liters of water will be good. And patients need to consult their doctors. It's individual. But when I say 2 to 3 liters, if you're talking about a 16-ounce bottle of water, 4 of these is 2 liters, about 2 liters. 6 of these is about 3 liters. So anywhere from 4 to 6 16-ounce bottles of water for most people, or half of your body weight in pounds, half of your ideal body weight in pounds. Yes. If you are
excellent
400 pounds, I don't want you having 200 ounces of water. But if you're 400 pounds and your ideal weight is 180, then you're going to drink half of that in ounces. Yeah, but again, consult with your doctor. But that's just like a good start. And actually, for a lot of things we're talking, probably for all of the things we're talking about, I have videos. So you mentioned my YouTube channel where we're almost at 1 million subscribers. I have videos. Almost. We're getting there. But I have videos on the benefits of drinking water where I really break down. I talk about alkaline water. Is it necessary? The different ways that water is filtered. I have different short videos on that. I talk about CKD stages, the way we broke them down with the 9th grader where you get an A, and I talk about what kind of happens at each stage. So for anyone who goes to my YouTube channel, Dr. Frita, Dr.Frit, as in take care of yourself, I have hundreds and hundreds of videos on kidney disease in a way that's easy to understand, in a way you can share with family members, to really decrease. Because knowing, especially that Black people are disproportionately affected by kidney disease, and is largely preventable in a lot of cases if you control the diabetes, control the high blood pressure. But again, there are some genetic predispositions. There's a gene, ApoL1.
Yes.
That is something that back in training, we didn't even know about it.
Didn't know about it.
It affects.
But we have to start asking. I told my sister when she went to see her PCP, I said, wait a minute, did you get this? And she goes, I don't know. Let me call back. I still don't know if she ever added it. I don't know if it's a special tube.
It's not a common test.
Huh?
It's not a common test that a primary doctor will be ordering or know about. Mostly the kidney doctors know. And so for the ApoL1, that's a gene that for about 14% of people who have West African descent, you're more likely to have that gene. And if you have 2 of the genes, ApoL1, so APOL1, if you have 2 of the genes, you have a very high risk of developing kidney failure and high blood pressure. So even if you're someone who's eating all the fruits and vegetables, exercising 5 days a week, kumbaya, meditating, if you have those genes, you just have a genetic predisposition. If you're a Black person, you're at a higher risk. So for anyone who has chronic kidney disease, especially if you have protein, high blood pressure, not really clear why, I would ask for that test. And if your primary care doctor says, oh no, that's not important, I'll be honest, depending on your primary, I'm not afraid to say I don't know, and I'll find out and let me get back with, right? But some doctors, if they don't know, they'll be like, oh no, you don't need to know that. So I want the viewers, the listeners, to be empowered. If you have a CKD based on what we discussed, and if you are of African descent, if you're a Black person, if you're Afro-Caribbean, if you're Afro-Latino, any of those things, say, hey, can you test me for ApoL1? Or then certainly if that EGFR is less than 60, just ask to see the kidney doctor and have that discussion with your kidney doctor. Because here's the reason why. In the beginning, I'm like, great, we got a gene. Well, nothing we can do about it. But now we have so much research.
Yeah.
And we have drugs that medications, and even some that have been FDA approved that are showing to help to reverse the effects of ApoL1. And we're only getting better and better, a lot of research. So if you have it, it's not necessarily it's doomsday. We're getting to the point where there's something we can do about it, but we can't do anything about it if you don't know that you have it. So remember that ApoL1. Yeah, a lot of doctors don't know about it. So
right.
The viewers
and so empowering. You have to go in. Oftentimes I tell patients that, or listeners, or when I'm out in the community speaking, because I love educating and I love empowering. We have to empower people. I said that to a patient today. We were having a little conversation before her visit, and I said, what you just said, we don't know everything. I was trained 25 years ago, been in practice now since residency, 21 years. And I am okay with someone coming in and say, hey, doc, I read about this. What do you know? And I'll be the first one. I'll be very frank and honest. Say, let me look that up. Let me research more, a little bit more. I think the audience members and our patients understand that we can't possibly, know it all, but they also know in our communities, there's such mistrust that it actually builds the trust.
That exactly. My patients know that if I am willing to say, oh gosh, well, I don't know, let me do some research on that. If I'm willing to say I don't know, they know that when I give them information that I do know, and they can trust what I'm saying and take it to the bank.
Yeah, absolutely. Well, oh my goodness, we have been going and going, and I do not want to belabor the hour, but this has been excellent. Before we go, just to the point that this is National Kidney Month, I want you to leave maybe you gave us some resources. For YouTube, it is Dr. Frita, where you can find all of that information. But if you want to share any other opportunities for our patients to learn, our audience members, to learn, I definitely want to encourage everyone, go back. If you got to rewind and write those things down. That GFR, what are we shooting for?
Absolutely.
90. We want to write down APO, L1.
That's it. You got it.
These things down, and we want to empower ourselves. You want to drink, 4 to 6 of these, as long as you're not already being restricted.
Exactly.
My takeaway, which I'm going to just take from you, if you are feeling thirsty, then your kidneys have already been screaming at you. I always I can't stand if I get in a car. You know how people now turn back around because they left their phone. Nobody's going to leave their phone at home. I just cringe if I leave my big water bottle at home. I'm like, I have a 45-minute drive. What do you mean I'm not going to drink my water? I am used to drinking water. So, okay, I'm going to let you take us out of here. If you have any last parting words, this has been so insightful, and I would just encourage our listeners to share. You can share this. I don't know, what's the next holiday coming up? At Easter, you can share this at the family reunion. Give them Dr. Frita's information. I mean, there are over 900,000 people following her for a reason. There is some good information out there. Thank you so much, but you take it away. Thank you, Dr. Frita.
That's it. Yeah. So with hundreds of videos, Dr. Frita, drfrita.com is our one-stop shop. DRFRIT, as in take care of yourself. I have hundreds of videos. I have playlists. You can catch me on the Don Lemon Show and some of these other national news shows. Look, the maternity court shows are very fun. All of that you can find through drfrita.com. But most importantly, understand that kidney disease does not look a certain way. Most people who have kidney disease don't even know it. You might have it. I'm not speaking this on your life, but you might have it and you might not know it. So the most important thing is to empower yourself with the knowledge, know your numbers, share this information with the people you care about so that they can know their numbers, because you're not helpless. You're not defeated if you find out that you have CKD. It just gives you the information so that you can fight and do the work. And so, yeah, let's go ahead. Let's spread kidney disease awareness so we can all live our healthiest, happiest lives.
All right. Thank you again. And we will see you on the next episode of The Pulse.
The content shared on this podcast is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. The views expressed by our guest and host are their own and do not necessarily reflect the official positions of GSMA. At GSMA, we stand on over 130 years of medical excellence and advocacy, but we encourage you to always consult your physician or qualified health provider with any questions you may have regarding a medical condition. If you think you may have a medical emergency, call your doctor or 911 immediately. Until next time, stay informed, stay empowered, and stay well.